But most of these veterinarians also feel comfortable offering alternatives, right? They're actively trying to improve care for underserved populations. You're all here, it's awesome, right? And how we do it is a little bit different, and we'll talk about that a little later, but I'll pass this on to Shadi now that we left him with 2 minutes. But I think this goes kind of through, so my thought is that we'll go through the slides, take a 10-minute break, go through slides, take a 10-minute break, so. And if you need to go to the bathroom, you're a grown-up, just go find the bathroom.
So thanks so much. So just a little more about me. I'm Dr. Shadi Rayfish, board certified small animal surgeon. I graduated from Cornell University in 2006. I then did my 1-year internship at Angel in Boston. From there, I did 2 one-year surgery internships at Long Island Veterinary Specialists in New York, then surgery residency. From there, I moved out west for warmer weather, worked at a specialty hospital in Las Vegas, 2016, then traveled around the country performing surgeries, finally landed in Silicon Valley for about a year, on call 24/7 for 3 facilities, and then after that, I became part owner of a hospital in Los Angeles, and then finally launched then in 2019, VetTriage. So in alignment with the financial concerns that was just expressed, there are plenty of resources for pet owners to try and receive financial aid. And of course, it's a very, very long list. There are both pros and cons to these types of options. The most significant con that I can think of is emergency care, because what are the chances that you're going to be able, as a pet owner who has financial difficulties, what are the chances that you're going to be able to access a lot of these funds on an emergency basis? And then for those that need these funds for more preventative measures, well, that requires planning ahead. Not everybody can plan ahead for whatever reason. So although there are many, many options available to them, these are not going to be able to satisfy every single person, every single situation. So a lot of this was already discussed. We think commonly, or we always talk about gold standard of care, which implies that new technology and intensive interventions are by default the best options. What this has done over time is converted gold standard of care to medical monotheism, where we now believe that the gold standard is the only way of intervening in a pet's care. It's the only way of having diagnostics performed for this pet in this situation. And that of course is a source of a lot of this, in my opinion, from the viewpoint of us as veterinarians. Adaptation of care that suits the client's preferences, limitations, and relationship with their pet to meet the needs of clients and pets. This is the hallmark of what we're talking about here with spectrum of care. You have to be able to meet the client, and that includes their culture, their ethnicity, their financial situation, where they live, all that stuff. And then the pet's care, what disease or injury does that pet have? What species are we talking about? What's the prognosis? And you have to be able to meet the needs of both individuals. So we'll go into the next slide into more details about the definitions of these topics. To me, they're all related, obviously. We can be more nuanced about these terms, of course, but in general, we're talking about the same thing here. What can we do to work with this client, work with their pet to figure out the best solution that satisfies all parties involved? Veterinary professionals are trained to provide state-of-the-art medicine, which is confused with standard of care. Two different things. We often confound these two concepts, but state-of-the-art and standard of care are not the same thing. State-of-the-art is the bleeding edge, right? The forefront, the newest, the greatest, the biggest, the baddest, and that's great. That's great that exists. However, standard of care is not analogous. A standard of care is, what are the minimal acceptable standards I'm willing to accept as a veterinarian to provide this pet and this client the best possible options? Veterinary professionals are trained to mitigate risk of litigation, disciplinary action by offering all diagnostic and therapeutic modalities. That's unfortunate. The two things that I hear about most often from new graduates are they're worried about being sued and they're worried about their debt. That's insane. They should be worried about how to diagnose a GDV or a cruciate tear or IBD in a cat. That's what they should be concerned about, the medical aspects of it. Not oh, what can I do to prevent being sued or being brought to the board? That's unfortunate. That's a toxicity that really upsets me. And so, because of this, we're practicing now defensive medicine. where I need to recommend all the things all the time for everybody because or else I might get in trouble. In alignment with what Serena mentioned earlier in terms of am I going to get in trouble if I don't offer stuff to the client or if they don't approve the best options that I provided for them. The biggest reasons why a veterinarian gets in trouble with a medical board and gets disciplinary action on them is poor communication and poor medical record keeping. We all know this. And communication and record keeping tie in, right? It's the same thing. Essentially, if it's not recorded, it didn't happen. It's he said, she said. It doesn't work. Record everything. You can offer all the things to all the people. Make sure you document that you did that and what they approved and what they did not approve. That has to be in your medical records. So if this does ever happen, God forbid, you've got protection in place for you in those scenarios. So more specifically, pet-specific care focuses on the patient's needs and the client's needs, wants, and expectations. A continuum of care focuses on the range of options available to the healthcare team, which includes the client and patient. Contextualized care focuses on the more flexible and inclusive acknowledgement that different treatment modalities may be equally valid in different contexts, and we cannot separate clinical decisions from their social context. All true, all makes sense. It's all part of this. So when you talk to veterinarians in general, 20% of vets do not offer treatment alternatives. So this is what we had in the other slide, just reversed, or inversed rather. 30% of veterinarians disagree that all treatment options should be presented to owners. This is also a concern to me. It's a concern. This should be 100% of veterinarians should offer alternatives. You want to offer them the best. You want to offer them what is considered gold standard, or at least standard of care. And if they can't do that, well then alternatives have to be implemented. They have to be. That pet is still sick, regardless of whether they purchase diagnostics and treatments for you or not. That pet still has to be taken care of. And you're the one that's at the forefront of that. Offering all treatment options should be presented to owners. Yeah, to some degree, sure. You know, if you have a foreign body obstruction, there's not a lot of options, right? You need surgery, or it's going to be euthanasia. You know, there are some that are more clear cut. There are others. The vast majority of our diseases that we see, you can offer things. You can offer options to pet owners, and you explain to them the pros and cons of these things, right? This isn't just like a blind sort of just to giving them a menu and let them choose. You discuss pros and cons and costs of these things. There is an expectation by clients that veterinarians support and validate decisions. This is the whole, don't judge me concept, right? Clients want you on their side. They want to feel that they have your blessing. They understand that they can't afford or pursue whatever it is that you're recommending, but they want your blessing and say, it's okay, I get it, I understand. Even when veterinarians disagree and client actions not medically appropriate or ideal, they seek validation and affirmation. They seek the veterinarian to understand and accept what they did and why. So that's all part of clear communication, making sure your client feels that the decision they're making is fine. It's fine. Humans versus veterinary medicine. Animals cannot speak. The time commitment to a consultation varies. A lot of our clients are performing their own research. Costs do not correlate to value. Fear of missing a diagnosis, continuing education, euthanasia exists. These are all integral differences. You can't really compare to a large part the human side versus the animal side. We're literally a different beast, and it's because of a lot of these. We have to rely on the pet owner to give us an adequate history. Our time commitment to a consultation, we're always pressed for time, right? You hire a new grad, they're going to take an hour for a consult. A more experienced person, maybe 10, 15 minutes in a consult. Time is money. And so we're pressured all the time to hurry up, which is not always great for both parties. Our clients are their pet's advocates. So they feel inclined to, at home, perform their own research with Google searches and whatever else, right? And we frequently get upset at them for doing that because we're doctors and Google is not. However, it's part of the profession, so we need to contend with it. Veterinarians are inherently bad salespeople. We just are. We care about the animal, we care about the patient, we want to make sure that they are taken care of. We're not looking to make a quick buck, we're not looking to sell them on anything. The problem with that, though, of course, is that also tend to undervalue your own worth as a veterinarian. The clients have no idea how smart you are. They have no idea what you can do in surgery. And we don't convince them of that. And so they need to be convinced of that. They need to understand your value. The fear of missing a diagnosis we already spoke about. Make sure you've got clear communication and record keeping. Continuing education, that's why we're all here. And euthanasia is a very unique part of veterinary medicine. That's always an option. Whether you're talking about a fractured limb or an IBD or a foreign body or a paralyzed dachshund, like we have this option. And it's both good and bad. It relieves pain and suffering, but it also allows for an easy out. How many animals we euthanize every year from shelters that can't get homes? We just euthanize, it's just like a normal thing. I mean, we're killing animals and we find it to be acceptable, which, again, pros and cons to these things. So I'll leave you with this. Perspective taking and seeking also require us to draw upon cultural humility and recognize that our clients view their patients' care journeys through a unique lens that may be influenced by personal, familial, cultural, and societal perspectives on the relationships with animals, the function and inherent value of the individual patient, as well as the uniqueness of their bond. That's how complex the decision-making process is when a client is offered stuff by you and they say yes and no to certain things. That's all happening behind the scenes are all these factors. You want me to?
I mean, they're just the conclusions. You can just leave them up there and then we can.
Okay, so conclusions. Our research shows barriers to care at the preventative, urgent, and emergency levels. The challenges impacting veterinary teams directly impact access to care. The lack of diversity and inclusion within the profession mirrors barriers to care. Addressing barriers to veterinary care and to the veterinary profession go hand in hand. Thank you so much, and we'll take any questions, concerns, or comments you have. Any questions? Yes?
I had a question about how incremental care was sort of defined. I've heard of spectrum of care and contextualized care being used pretty much synonymously, but incremental care being a strategy within that. So if a client comes in with a vomiting dog, they're, instead of doing all of the diagnostics at the beginning, you might start with palliative care, and then incrementally, depending on how that animal is doing, adding in diagnostics as it goes, where that would be an option on the spectrum of care within the context of, yeah.
Sure.
Go ahead,
I mean, if you want to, you can.
Go for it. I'll jump
Yeah.
on.
So is your question what is incremental care, or do you want just more information about it?
What I took from when incremental care was mentioned in the presentation was that it is synonymous with spectrum of care and contextualized care. So I was just wondering how, but
Yeah.
as you know, there are not universally accepted definitions of any of those things at this time. So
Yeah.
I'm just trying to get a better hold on how you're.
Yeah. So I think there's a difference between saying, okay, we're going to present all of the options, and then we're going to narrow it down to what is most important to do today, but we're still going to get approval to do all of those things, and we're still going to do them, versus saying, okay, we got to start here and then slowly go up. So personally, when I'm out and when I'm working, I'll say, here's all the things. So we get the vomiting and diarrhea dog. Here is your $1,000 estimate, right? So in an ideal world, we would do sub-Q fluids, we would do radiographs, we would do blood work, we would do a pancreatitis test in addition to the blood work that may or may not cost an extra however many dollars, right? And you kind of start, we're gonna do some Serenia, we're gonna do these meds to go home, we're gonna do a fecal, we're gonna do a culture, blah, 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 right? In terms of incremental care, we're essentially saying, okay, we're gonna do some Serenia and some sub-Q fluids, and we're gonna give this pet a few days and see how this works. As long as they're still pooping, then we'll sort of see how it goes. When we're talking about contextualized care, we're sitting down and saying, okay, this is a 2-year-old doodle, we're starting with radiographs. How many socks did he eat this time, right? So is it a dog that is likely to have this or this or this? We're really targeting that care to what we think is most likely in that patient versus starting with the symptomatic care. So personally, what I do is I just say, here's your $1,000 ones, and then most of the time, strangely enough, people will say, well, can we just do the blood work today? And I'll say no. If you're gonna pick one thing, we're gonna do the radiographs today. And you're kind of guiding where some of that goes, but in both, you're still using contextualized care in terms of what is most likely and most useful for that patient, right? Like if I do an abdominal palpation and that dog is like yeeping in pain, I'm like, well, is the pancreatitis test, if I do it by itself and it's $170, but $200 if I do it with the full blood work, do those $30 make a difference to that person? But honestly, if I do that today, will they be able to afford the treatment? And the reality is, whether that pancreatitis test comes back positive or negative, if it's a snap-on test, I don't know that it's gonna change how I'm gonna do treatment, right? So let's do a blend diet, let's do some pain medication, let's do some sub-Q fluids. And if we get worse, then I feel like they still have something in their pocket to go to the ER and like take care of stuff there. But if I'm looking at a pet that walks in and I'm like, okay, so we had a cycle a few months ago and we're a 3 to 5 year old pit bull and I don't do surgery and we have a really bloated abdomen, I'm not charging you a physical exam today. We're just not gonna touch that dog and you're gonna go to the ER down the road where there's a surgeon that once they do their exam can decide if you need to go straight into surgery, right? So does that make sense? Anything?
Yeah, just kind of to reiterate what Valerie was saying, I think contextualized care is, based on what the situation at hand is in terms of taking into context the pet, the signalment, as well as what's the situation, with the pet owner. Are they going to be able to come back in a couple of days? Are they going to need to wait a week before they get their next paycheck? And so contextualized care is very specific to the situation of the pet owner, and the environment that we're in. And incremental care would be kind of the options of steps along the way of the spectrum of care that we can then move forward with based on the contextualized care plan for that day. If that kind of helps at all. But yeah, I think yes. Go ahead.
I think a lot of this has to do with communication.
Yes.
Because you don't want to get in the mindset that when you have a pet that presents with clinical signs there, that you're already like judging or having preconceived
Mm-hmm.
conceptions of, what is this person going to be able to afford or not afford there. So I personally feel that we should present, as we
Always.
talked about,
Mm-hmm.
always. These are the options that we have available.
Mm-hmm.
This is what we should be doing to understand what is going on, so that yes, we do present that gold standard. But then with communicating properly with the owner,
Mm-hmm.
I know that there are times that we cannot afford all of this,
Mhm.
but what are you able to work with me about so that we can get your pet better?
Yep.
And then
Yeah.
I feel that's where you can get to that delineation of, I'm going to mess all these terms up because this is all new to me. The incremental care and the
Contextualized care.
contextual care.
Mm-hmm.
That you can then go to either one of those, at least in my understanding.
Yes, definitely. Communication is key, both in terms of communicating with the pet owner to figure out, again, the context of the situation, figure out their contextualized plan, as well as what are going to be the incremental care options as next steps along the spectrum of care. Exactly as you said, we can't go in with any sort of prejudice or judgment. We do have to communicate with the pet owner and acknowledge those communications in the record. And as you were stating, it's imperative to be able to offer all the options, but doing so without an air of judgment in the case that they cannot, and having an understanding of, okay, this may not be feasible based on X amount of circumstances, and let's come up with what this specialized and or basically contextualized plan would be, and what are going to be the next steps on an incremental basis in the case that things are going to worse, better, or stay the same?
And in case anybody forgot, I had said that like our break is sort of when we're doing the Q&A. So like if you need to go use the bathroom, go grab caffeine before we start in like a couple of minutes. We're not gonna think it's rude because we know you need a break. Go take a break.
I
See,
also need to go to the
see,
bathroom.
we're not judging.
If I could add one thing to that, another impression I had from the way you phrased your question was I usually start with palliative care and then I work up from there. And although that may be the way that you usually operate with these cases, or maybe that's your experience with your client demographic, I would say no, it's the client who tells you what they want to do. So instead of you saying typically most of my clients 80% start with fluids and Serenia, go home on a bland diet. That's not up to you. The client decides. Your job, our job as veterinarians, educate them and tell them what your experiences are with it. That's where you live. And then the client tells you what path they want to take. They might approve the $1,000 worth of testing, then they can't afford treatment. Our job as veterinarians predict the future. If X, Y, and Z are found in these diagnostics, here's what you're potentially looking at for treatment. Everything from fluids, Serenia, whatever, to major abdominal surgery at the specialty center, and everything in between. Are you're okay with that? Not in a way to intimidate or scare them away, but to let them know this is just the beginning. This doesn't include treatment. This doesn't include intervention. These are radiographs, blood work, fecal, whatever. So that would just change the
Yeah, I was talking about like the definitions from an academic standpoint. So because I've given and been to a fair number of access to care talks, and the definitions are not always consistent. So like if incremental care is being described as any of the options along the spectrum within the context of the owner and the pet, that personally doesn't make sense in my brain, because in my brain incremental care is taking the care in increments that changes based on the changing
So I mean,
context.
incremental care is in a way a type of contextualized care.
Yeah, it's a strategy that you use within it. Because sometimes, if you're looking at a cat that's been blocked twice, maybe you go straight to PU. So that's not incremental. That's like hitting the big time right away, because that might actually save time and money. So I wouldn't consider that incremental, but I would definitely still consider that contextual care based off of the spectrum that meets the standard of care.
Yeah.
that's why these definitions to me, although they have definitions, I'm always like, it's kind of one and the same. It's all related. The point is, the major concepts
there
are.
was a poster in the exhibit hall where a student at Purdue put together, just like went through all of the papers, and the conclusion was there's a lot of definitions, they're really close, we still need to figure it out. And I was like, okay, good. That's about where I'm at too.
Pretty much. All right, we'll start in a couple of minutes. I'm gonna grab a little bit of water, and we'll go from there.
Sure.
a lot of these we actually did like talk about at the previous one, and then we had some introductions that now we can skip also because you already know who we are. Yay! So, Shadi, floor is yours. Let's see if it's on. I might have turned it
Oh. Hello. Okay, so we're gonna go over all the different types of veterinary care that are available. Everything from mobile services, home care, pop-up clinics, spay-neuter clinics, vaccine wellness clinics, urgent care, ER specialty, vet schools, and virtual care. And of course, my area of expertise now is virtual care. I operate VetTriage, and just to update you on some statistics that we have on the platform, in case you're not familiar with VetTriage, we have been in operation since the end of 2019. So before the pandemic, I've been working on this concept for about 15 years. Over time, developing the technology for it in order to have our own platform. So it's all internal. We're approaching 150,000 cases since our launch. We've been accessed by pet owners from over 20 different countries. We've triaged over 40 different animal types, everything from fish to sea otter to ostrich. We've seen a bunch of stuff on the platform. I've got 60-ish veterinarians on staff, and we're constantly growing. I have a handful of support staff that manage the phones for customer service reasons. We're operating 24/7. We've got probably 1,000 partners now across the globe. Most notable, we have Cornell University uses us, University of Minnesota, a whole bunch of SPCAs and humane societies. And then in 2022, we launched a Spanish-speaking platform to help that community because, for the reasons we already mentioned, they are struggling with access and spectrum of care. We then launched an equine platform in 2023. We have published our first research paper last December in Frontiers Veterinary Science magazine of 15 novel species that were aided by the use of teletriage. We have 4 more papers coming as well, so look forward to that. And then this year we're launching VetTriage Pro, which is a mentorship-based platform for new graduates, those who are in their first job, let's say, for example, don't have any oversight, have a case that they're concerned with, and they want to talk to an experienced veterinarian to get peace of mind and get direction. So when you look at virtual factors, and a lot of these are intuitive, we know this, but when you look at the advantages and challenges of virtual care, here are just a number of concepts. Obviously, virtual care is very convenient. It can be provided, it can be accessed anywhere across the globe, as long as you have a device and internet. It's affordable, it's versatile, it's efficacious, it's simple to access. You can accommodate different languages, different cultures. It's available to all. It's available 24/7, any animal type, any concern. It improves practice operations in the veterinary culture, and this is key. We'll talk about it in more detail later on. But by partnering with facilities like Cornell and humane societies, we are able to allow them to have work-life balance. If they know that they can turf clients to VetTriage either during operating hours or after hours, it allows them to be able to give their clients an option when they can't be seen in person at that facility and not have that client automatically go to the emergency hospital, which is going to be stressful and expensive. Not every case needs that. The majority don't. Over 80% do not, that we find from our data. And virtual care works in tandem with brick and mortar for diagnostic surgery, general operations, etc. You can use it either internally within your practice or a platform like mine that's outside of brick and mortar to help streamline your process, your internal workings, workflow. Challenges, of course, there's a huge variation between different platforms. VetTriage is not the only one that exists. The antiquated and confusing legalities surrounding it is always a concern for veterinarians, and so we're looking to challenge those concepts. There are strong opinions from veterinarians and organizations that may not be as experienced with telehealth. That's an unfortunate setback. And of course, we're lacking veterinary literature, which is why we're publishing papers on this. So when you look at telehealth overall, and this is based on the American Veterinary Medical Association definitions on their website, telehealth is the overarching term that includes anything virtual between doctor and client/pet. That's telehealth. That's telehealth. And underneath telehealth are all the categories of it. So we often think of telehealth as being synonymous with telemedicine, but telemedicine is actually a branch, a category of telehealth. And so VetTriage lives in the teletriage, teleadvice world of telehealth, where a veterinary client-patient relationship is not required. But we're all familiar with teleconsulting. Every time we talk to a board-certified radiologist that are located remotely, or teleconsulting, telecommunication, telesupervision, telemonitoring. Telemonitoring is going to be the next boom, where we're going to be offering diagnostics at home for pet owners to be able to monitor. You're already seeing it with diabetes, right? There's ways now to constantly monitor blood glucose levels at home through pet owners. And then here's telemedicine, which requires a veterinary client-patient relationship. These are all branches of telehealth. Telehealth is the overarching term, and those are the different branches. So telehealth, veterinary veterinary healthcare services, public health, telecommunication technologies to provide all these wonderful benefits, and the client and patient are located at one location and the provider at a different location. Teletriage, do you have an emergency or not? Yes or no? Teleadvice, what advice can I provide for you for that situation? And to me, these two things go hand in hand. You can't really tell a pet owner, no, it's not an emergency, see ya. They're going to be like, well, what do you think's going on? What are the possibilities? What can I do? What should I monitor for? So these things kind of go hand in hand. When you look at the different platforms that are out there, because again, VetTriage is not the only one out there, there are different concepts to consider with virtual care. Are you going to provide this within your practice? So do you need software to download? Are you going to provide video or non-video capabilities? Are you providing this within your facility, outside your facility, an external provider? Are you asynchronous or synchronous? Asynchronous means there's a delay between communication. So text messaging or emailing, right? That's an asynchronous form of communication. It's not real time. Synchronous are things like video and over the phone. They're happening in real time. There's going to be an immediate response. Are you going to have veterinarians or licensed veterinary technicians, or both? Are you going to include specialists and GPs? What type of telehealth? Are you providing teletriage, teleadvice, telemedicine? What species? What hours of operation? How are you going to handle medical records? And what about HIPAA compliance, which is not a term that we use on the human side. VetTriage is HIPAA compliant, because I do believe that the future of this, cybersecurity, is going to be a massive problem. And it already is a problem in brick and mortar. I don't know if anybody has ever experienced it themselves or known somebody that's had a cyber attack, stealing clients' credit cards and what have you. It's happened to massive multi-million-dollar companies. So it's a problem. Those are all things that you have to look into. With the process of VetTriage, this is, if anybody wants to take a picture of this, you're welcome to. If you're looking for a partnership where we can help with your daytime overflow and your after hours for clients, we'll have a meeting to discuss how your facility operates. We'll then have you fill out a template. We're going to create a landing page for you, so you'll have this landing page that you'll attach to your website. We'll make flyers and a protocol for you, and we'll go into this in more detail later on. But the process to get started with us is simple, and it's also free. We don't charge the clinics anything to use us. The partnership is free. Clients pay us directly to talk to the doctor on video 24/7. So that's the goal there. No contracts, no agreements, nothing like that. This is an example of a report that we would send to your facility. Let's say we saw your client after hours. We deemed the situation not an emergency. We're going to give the client advice and monitoring parameters. We're then going to email the partner, your facility, a report, and it's going to be quite an extensive report from VetTriage, going over what the history was, what the video exam findings were, a whole bunch of interventions and monitoring until you're open again. Once you're open, that client's yours again, and that way it maintains client loyalty, and you don't lose that client to ER, and the client didn't have to spend money that they didn't have to spend on emergency treatment that wasn't necessary, and the stress of traveling, especially in this case, it's a horse, so the traveling is an even bigger deal. And that's what I have for virtual care.
So I'm going to talk about preventative care strategies, and I think many of you that have been doing or have considered or have gone to other lectures on access to care will know, like, none of these can be just like defined in one place. There's a lot of overlap between them. So I'll talk about the ones that involve preventative care, and then Serena will come in and chat about the ones that involve more ER urgent care. But again, none of them are clear cut, right? So disclaimer, we're gonna do some limited discussion on like what I call traditional GP or traditional specialty, just because that's what we're most familiar with. If any questions arise on them, feel free to ask questions, but we'll hopefully focus more on those less traditional strategies like we just did for virtual. we talk about physical care, right, we're talking about brick and mortar potentially, we're also talking about mobile, and for both of those, you can have, GP, you can have specialty, you can have wellness, you can have, spay and neuter, you can have urgent care, ER. In terms of mobiles, it also includes having, house calls and mobile and pop-up clinics, but a lot of these same types of care exist in one form or another, whether you are mobile or whether you are at a physical location. When it comes to GP is what we're using as our quote unquote benchmark, because that's what we learn about in school. So it involves in-person care. We often talk about continuity of care, and that can be when you have those medical records available that you can see that client or patient regularly. There's usually a team that is in control of that schedule, and we'll talk about why I decided to actually put that on the slide. There is theoretically more diagnostic and treatment options than what you can pack up in a car and move around with you. And then there may be surgery, there may be dental care. Not every place will offer it, but generally a lot of the GP practices will offer this. And then you have, okay, cool. When we talk about full service, then we're also talking about, potential issues with accessibility, right? So everybody talks about cost. I'm not saying that is expensive, right? But when we talk about some of the mobile options, like some of the vaccine clinics and the pop-up clinics, they can be relatively less expensive. You also have transportation. I think we've mentioned this, a couple of times in both of the lectures. Individuals have to be able to get there and get, to and from there, whether that is in public transportation, in their own vehicle, or, having a leash or a carrier for their pet. And then there's the cost of the equipment. When we talk about some of these alternatives, oftentimes they don't have as much of that big equipment, and so the overhead can be less pricey. So in terms of that cost, and like with equipment with accessibility, that is the leash and the carriers and whatnot. But when we talk about the cost for the practice, then we're talking about, the price of the equipment and the facility and the staffing. We also talk a lot about some of these pet stressors, and that's not non-existent in alternative, practices that we're going to talk about. But when it comes to limited care, has anybody worked at wellness practices before? Yeah, so I see at least a couple of people. So if there's anything, I've worked primarily with one company. I know more about some of the other companies out there, but if there's anything that you're like, oh, she forgot to mention this thing, I'm always willing to learn about what others do. But a lot of times with these wellness, you have essentially a room. And in that room, you may have the ability to do some really basic blood work, right? Like we may do some snap tests. If we're gonna do a CBC and chem, we can send that out. And you can do a fecal, you can do some ear cytologies or some skin scrapes and things like that. But for the most part, that's it, right? You don't have the same variety of medications. You don't necessarily have all of the equipment. If something comes in and you need to intubate it, chances are you don't have what you need. But there's a lower overhead cost because of that, because there is less equipment. So in terms of like starting it up, you're not trying to find a facility that has like a place where you can have a surgical suite and you don't need, surgical tables. And oftentimes it is, a veterinarian and a couple of technicians or assistants, and that's it. You don't have a lot of people. And so even though it can be convenient in a lot of cases, right, you still have some of those limitations. And often you don't have surgery space and you may have limited space. So this is one of my patients and this is the owner back there, right? So you may not be able to take that pet into a treatment area where they're actually not with their, with their owner. So oftentimes I find people sort of slowly lifting their phones and I'm like, hi, no phones here, no recording, because I have found myself on Snapchat, right? Like, not enjoyable. It's not usually something like mean or anything, but they're like, oh my God, Fluffy's like first visit. So sometimes it works. It can work really well for patients that are primarily, healthy or just have allergies. But if somebody comes in and I'm suspecting something that is more complex, then they're gonna have to go somewhere else, right? So if they need to be spayed or neutered, they've got to go somewhere else. If they turn out to be heartworm positive, got to refer them somewhere else. So it's one of the limitations. Then you have mobile, and I'm breaking mobile into two different things. I consider a lot of the pop-up vaccine clinics in that mobile category, but there's also house calls, right? And when it comes to accessibility, they have different kind of advantages and disadvantages, right? So when we're talking about house calls, you can have pretty good like wellness checkups, right? So you're going into the person's house, you're seeing the pet in their own environment, you're seeing what they're eating, what they're drinking, they're potentially less stressed. You can do, yes, your own schedule, but because you're going from place to place, you're seeing less patients per day, and you need to have a vehicle, and theoretically you have, an assistant or technician and a veterinarian that are kind of going to these places together, so you may get to see, depending on the geographic location that you're covering, like maybe 5 patients a day. So in terms of affordability, right, it can be very variable because a lot of times you're trying to take into consideration that mileage, the fact that there's a vehicle, you have to have systems for, booking and scheduling, and theoretically you're charging a fee for actually going into that individual's home. But a lot of times when we think of accessibility, we're thinking of socioeconomics, and like we said, if you have patients and clients that have mobility issues, that have disabilities, that have chronic conditions, that might limit them from going into a brick and mortar location. So being able to have a house call available to them is a form of accessibility. And then you have, vaccine clinics, which oftentimes these pop-up clinics are lower in cost. You're in the middle of a Tractor Supply or in the middle of a Petco, and you have a line of 30 people, and you're just kind of going and going and going, right? In some places there will be appointments, 5-minute appointments. Other places is whoever lines up by this time gets seen. And for those, costs can be, you're seeing a lot more pets per time. You're doing a limited physical examination. So a lot of times the cost can be lower. It's not always, right? Sometimes the cost is only lower because you actually cannot offer many other things, right? So you're doing in bulk, sending in all of these heartworm tests. So it may be slightly cheaper per test, and you're not paying to have staff members like they're running the test at all times. So there are different reasons and ways, but oftentimes they're done on the weekends, they're done in the evenings, and so the days and times when they happen can increase accessibility for people who may not be able to take off work during the week or during the day to bring their pet into a different location. And again, limited resources, right? So sometimes I bring in my own prescription pad, and I'm like, if you need a diet, then here's your little written diet, right? But other than that, it is very unlikely that you're going to be doing a bunch of prescriptions for anything other than like heartworm preventatives. And because you're seeing so many patients in such a short period of time, you're not necessarily putting in as thorough notes as you would otherwise. Sometimes what people will do is they'll have like their soap and they can like copy and paste it into each one. Or what I do, which is go in the notes and just anything that is abnormal, I list. Right? And some of those systems work really well that you can like click on something and it selects everything as normal, and then you can go through and just manually mark anything that is abnormal. But when you get pets that, have not had care in long periods of time, chances are you may see ear infections, you may see teeth that are not great, right? Like you may hear murmurs, and then it can be harder to see those things sometimes because you're again in the middle of a Tractor Supply or something, and you're trying to like both sing and dance to country music while listening to the pet, and like that heart just like yeah. So it can be difficult, but it may be good. It is good sometimes for pets that only need one vaccine, right? Like I sometimes get somebody that's like, yeah, we just need a Bordetella, and our vet can't see us this week, and I'm like, okay, as long as you have proof of rabies, I can just do the Bordetella and a quick physical, and we'll move along, right? But it may also be for pets that would not otherwise see a veterinary team. And if we're trying to choose between, gold standard and never seeing a veterinarian, then these can really, really be helpful in access in different communities. And because they're mobile and you have a lot less equipment and you can kind of go into different communities. So some of them, as many of you know, are done by larger corporations, right? Like Vetco does one and VIP does one. But we have a lot of community organizations and shelters and rescues that will actually do some of these in communities that specifically need them as well. So they take a lot of coordination and partnerships and a lot of marketing, and I assume Serena might talk a little bit about what you do with some of these in the next presentation, maybe? I don't know.
Mobile care?
Yeah, the mobile, yeah, perfect. But again, limited examinations, limited records, limited service. And if you have a sick pet, they get turned away. They are turned away. Then you have spay and neuter clinics, and I haven't actually done these, so I'm gonna touch on them in a very basic manner, but I think, have either of you done? Yeah, you've done them, right? So if you all have questions about them, we're trying to like split things efficiently, but also have people here that have kind of experience in a lot of these areas, right? So oftentimes it is very specialized, like all they do is spays and neuters, right? And it might be like a mobile unit that is just going places, and we're parking here today and we're doing them. It can be very hard for them to find veterinarians for those. I think the one in North Carolina just closed because they spent about a year looking for a veterinarian and they couldn't find one. Access, so cost, because they're very much like, this is what we're doing. You can get very specialized equipment and that's it. But oftentimes, you may not have as much pre-op and post-op care. So the reason I have this picture here is, can anybody guess what that is? Yeah, so I remember asking them, like, so when was the spay? And they're like, oh, it was a few weeks ago. I'm like, okay, so I don't see a cone. Is the pet wearing a cone? Well, she didn't want to wear it. Okay, so where did it happen? Where was it? This clinic? Okay, we get the information. I'm like, so the first thing we need to do is actually contact that location, right? Because they will do some post-op care, right? So you can call that surgeon and say, hey guys, like, we have this, and they can go back in. We can do some of that care, a GP practice, but a lot of times they will have something in place where you can go back. But if it's an issue that may be unrelated to that, they may still, or if it's something beyond what they can do at that time at that clinic, right, they may still send that pet to a GP practice. So then they're gonna be going kind of back and forth. So that's it for the ones I wanted to mention. So here it goes. Oh, and I didn't go over like the specialty care and some of those. They come in to play with some of the things that Serena will be talking about, but if you really do want to talk more about the really high specialty care, we can later on.
Thank you. Okay. Do you guys like this diagram? I like it. As both Shadi and Valerie were talking about, we have a variety of different types of service providers that are going to have their own place in this access to vet care ecosystem. And with that, we've discussed the primary care, and virtual care would kind of fall under more so with teletriage specifically, kind of urgent or emergency if they're needing to be triaged. But sometimes if they're triaged and they're stable, then they can potentially wait for primary care. What I would be discussing, or what I'm going to be discussing here in a little bit, would be more so the role of urgent and emergency care. So as Valerie had mentioned in the last presentation, studies show that due to accessibility challenges, over half of the pet owning population experiencing either urgent or emergency needs actually do not seek care. And then when pet parents delay care, the problems worsen. By the time they do seek veterinary care, these issues can become life-threatening, and then they have to look to emergency care, it can be incredibly expensive to the extent that they may not be able to treat it. And unfortunately, this situation can frequently lead to pet surrender, premature pet mortality, or in the worst case would be economic-driven euthanasia. So while efforts to ensure preventative care and education have become more widely available, it's evident that we do need to do better to provide access to urgent care and education. A lot of pet parents may not know the difference between urgent and emergency care. I would assume previous to this, we were discussing, barriers that are going to be preventing people from seeking urgent or emergent care for their pets, even when it does become necessary. So cost, education, and geographic barriers are going to be, typically preventing people from seeking urgent and emergency care for their pets. So one would be, education. While we are educated on the difference between what urgent and emergency care is, a lot of pet parents are not educated on when they should be taking their pets into urgent care versus when they should be taking their pets into emergency care. And what ends up happening is a lot of them will go into emergency care, find that it's too expensive for them to treat, and then are not going to go back to a veterinarian because of their negative experience. So we need to make sure that pet parents are going to have an inclusive experience when they do come to emergent or urgent care, as well as making sure that they do receive proper education, and that can start with their relationship with a primary care veterinarian, in terms of if anything comes up, for them to be educated on, hey, these are your options. This is when you should potentially seek urgent care, and this is when you should potentially seek emergency care. So there are differing strategies to create accessible care for sick pets, and that includes mobile ER urgent care, brick and mortar urgent care, brick and mortar emergency care, and a combination of these strategies. So urgent and emergency care can complement one another to ultimately create a spectrum of care. Urgent care is going to typically be less expensive than emergency care and can take away some of those cases that are urgent but non-emergent. So they're not going to be life-threatening illnesses, but they shouldn't wait, anywhere between 72 hours to 2 weeks to see their primary care veterinarian. So that's the value of having the urgent care. It also relieves the burden of emergency care veterinarians, so creating more time and space for them to be able to focus on the more life-threatening cases. Can you help me out real quick? I'm just trying to go down here. Oh, thank you. Okay, very nice. Valerie's more experienced than me.
It's just my laptop.
Oh, this is your laptop?
Yeah.
Oh, okay. That's where you're more experienced.
Yeah.
Okay. Yes, so going into those barriers that were discussed just a moment ago in terms of geographic costs and education barriers, these geographic barriers can be addressed with mobile, urgent, and emergency care options. This is very, very limited in terms of what is available out there, but current solution that we can consider is potentially, having transportation between urgent and emergency care in the case that, they come to an urgent care and it ends up actually being a more emergent case. And also, if we have an urgent care that is strictly mobile, which they can then refer out to an existing emergency brick and mortar practice. Cost barriers, as we discussed, can be addressed with more affordable urgent care options prior to the problem becoming But the good thing about being able to acknowledge that is now, we know what we can work towards. Oh. It happens. Okay, so with regard to this ecosystem, we have to recognize the role of the veterinary service providers, whether they are going to be in primary care, urgent, emergency care, specialty care, whether that be on a virtual, mobile, or brick and mortar basis. But the other half of it that we do need to recognize would be the pets and the people. So community members are going to directly connect with the veterinary service providers and support one another in seeking access to care, and they need access to spectrum of care based on the ever-changing needs of their pets. So having, both the people, the pets, and the veterinary service providers in equilibrium is ultimately going to create a more successful ecosystem for accessible care and accessible education. And this is another diagram that I like. So here we have veterinary service providers and then also the people and the pets. And in the next presentation, we will cover the needs of aligned partners to be able to create access to care initiatives that will ultimately allow for accessible care and an accessible profession between the veterinary service providers and the community involving pets and people. Okay, so examples of these aligned partners would be community organizations. So grassroots community organizations are going to act as connectors to care through providing resources for the pets in their communities. And then human services organizations such as social services organizations often are going to be able to connect people and their pets to inclusive and accessible care. We have aligned B2B or business-to-business service providers that are also going to be aligned partners to help create this equilibrium. One example would be relief service organizations. So this would be reliable, mission-aligned relief staff. They're going to help keep the doors open without interruptions to care and ultimately relieve the burden of primary, urgent, emergency, and specialty care services to be able to see more patients more efficiently. And then other examples of B2B service providers would be technology vendors and suppliers that are going to be able to provide the services that allow the businesses to run efficiently and also reducing waste. And then lastly, we have teaching and learning organizations. So these are going to be professional development and veterinary education organizations. And we'll go a little bit further into this in the next presentation. An example of a professional development organization would be Pawsibilities. And veterinary education, of course, we would think about veterinary schools, but also the externship opportunities, internship opportunities that are available to individuals to learn more about accessible care and the value of that, which Chapter 8 is also focused on. So we'll go a little bit further into that in the next presentation, but I just wanted to give you guys an idea of, on a general basis, the fact that we need to have veterinary service providers along the spectrum of care in equilibrium with the community, given that the community would be the pets and the people. And in order to make that equilibrium possible, we need aligned partners to be successful, to create access to care, and in doing so inherently create access to the profession and vice versa. Thank you. Do y'all have any questions? Or I should say, what questions do you have? No? I even prompted you guys. Oh, okay.
I do have a question. So with the VetTriage, you mentioned that you're in 20 different countries. So how do you keep the different laws that govern veterinary medicine in those different countries? I don't know. I mean,
medication or whatever, the pet gets in trouble, they don't know what to do, and so they search and they find us. So a lot of them are not even local to that area. Regardless, that's my point with antiquated guidelines, because virtual is everywhere. Any client can DM you guys on Instagram, go to Facebook and ask a question and have some Joe Schmo answer a medical question without any sort of operating standards, without any sort of oversight, none of that. So my stance on this is, instead of having clients just Google searching and asking random people for help with their pet, have them talk to an actual professional veterinarian who can guide them accordingly. Understanding that there are going to be some regional differences, but ultimately a sick pet or injured pet is just that, and so we can help them out. So that's my stance on it, is we are behind on that front. Virtual care is accessible to everybody, and so unless there's some way that we can create barriers of entry, which we don't want to do, people need pet care, then we need to figure out a way to update our laws so that virtual care can be more accessible to more.
And Sean, you're not diagnosing and prescribing in most cases.
Yeah, and so a lot of the concern with this is around diagnosing and prescribing. Well, teletriage and teleadvice is just that. Is it an emergency, yes or no? And if it's not, what advice can we give you? Communication is paramount to this. So if you have a 3-year-old Labradoodle that's vomiting and diarrhea, there's 100 differentials for that. In no way, shape, or form are my doctors expected to, nor can they, say, oh, your dog probably has a foreign body, probably pancreatitis. We have no diagnostics. We have no ability to perform physical examination without using the owner's hands. And so we stay in our lanes. Teletriage, teleadvice. Yes?
I was going to support that, and I regretfully missed your part of the lecture, but the laws around the telemedicine are really confusing, but you don't need to have an established CPR in order to do teletriage, which makes it
Yeah, so in case you couldn't hear her, the veterinary client-patient relationship, the VCPR, is not required with triage and advice. Additionally, when I talk to other countries, which I do frequently, they are 10 to 20 years behind us in terms of veterinary telehealth. I mean, they're archaic compared to what we're doing, and I consider us behind compared to the human side. So there's a lot more evolution that has to occur globally on this front. Oh, sure, yeah.
So I'm going to do an example, and I'm going to do that example because it's you asking the question, sorry. So strangely enough, and I mean, you tell me because you're the boss in that part of things, like, strangely enough, there are a lot of poultry people asking questions on there. A lot of people with backyard birds that may not have access to, a veterinarian otherwise. And a lot of times I get kind of called in to help with those, and sometimes it's fun. So yesterday,
Yeah.
We got a case, and I got the pictures from it, and one of the birds had died, but we got enough pictures to see some like sulfur-colored feces. Yeah. Anybody in the room that is not Dr. Williams know what that should make you think of? You all took the Navly, but I mean, whether you remember the 5 poultry questions or not, it's fine. No. Nope.
Yes, Merrick's, it's a fair guess.
If I mention Navly, Merrick's is always a fair guess because they will ask 30,000 questions about Merrick's. But sulfur-colored feces are most likely due to histaminiasis. And we see a fair amount of like histaminiasis in backyard poultry because they're going around pecking the earth, and you have, the earthworm that has the cecal worm that has the histomonas in it. Like it's a whole thing, right? Can I say to that person 100% that's what's going on with their chicken? Nope. Right? Maybe if they were like inclined to open the bird and show me the liver, I could like actually make it like telemedicine, go from teletriage to telemedicine, and like potentially say, this is what you need to do for your other pets, right? So the answer is not, this is what it is, but this is what it could potentially be, and here's an over-the-counter option you can try, but just so you know, we don't know that 100%, and if your other birds are showing other clinical signs, like, let's find a veterinarian in the area who can potentially help, because it's not necessarily an emergency, right? But it happened to be in Ithaca, New York, where Dr. Jane works at Cornell University and does a lot of poultry work, so if need be, that's a person to reach out to. So anyway, But Shadi had the AVMA diagram with like the different forms of like there's a telehealth and then to telemedicine and
telehealth being
teletriage
the
and
overarching term and everything else being categories of that.
but the only reason I can like give even that example is because like all of us try to work together as much as we can. Was there another? Yes.
I have one actually before Selena. So when you're talking about particularly community engagement in lowering barriers, do you have examples of that? So like, is it if you're having, for example, like a low cost clinic that's going to come visiting an area, how do you bring in community partners to assist with that?
Are you gonna be here for this next presentation?
Unfortunately, I have to go catch a flight.
No.
So no, sadly.
Oh, no.
So can you just give it to me in like
It, yes, everybody. I'm gonna give you my presentation in 2 minutes. Yes. So yes, there are a number of partners that we do work with, including some organizations that I've started myself as well, to engage the community, whether that be through low cost or free vaccine clinics that we combine with educational events for the community, and we've done that on a bilingual basis as well, so make it more accessible to the community in that way, by offering education in Spanish and English, making sure that we do so in a non-judgmental way as well, so kind of understanding what the situation is of the client. Are they going to come in for just vaccines? And then, as Valerie was stating earlier, there's plenty of cases that come in that have more illnesses than we can take care of at some of those free clinics. And so we make sure that we have partners that are going to be able to offer the full service options or potentially sick urgent care options, and doing so at a level that's going to be inclusive and accessible for them. So again, if the expectation is they came in and they're predominantly Spanish speaking, we're not going to send them to a clinic where we know there's nobody there who is going to be Spanish speaking. We're going to send them to a clinic that is both, let's say that they have financial limitations and also, right? So we're going to send them to a clinic that's going to be an affordable care clinic with the option of having predominantly Spanish speaking staff. And we also engage community partners that are going to be helping out with issues such as clients that are facing domestic violence, for example. So making sure that we're not necessarily reinventing the wheel is really, really important. And yes, and that's what we're going to go over kind of in the next presentation as well, is how we can kind of map out the ecosystem and identify what the barriers are, because each community is different. So identifying what the barriers are, and with that, not necessarily creating brand new organizations or stepping on the work of what other people are already doing, but actually collaborating with them and creating a strong and successful partnership. There are factors to be able to create a strong and successful partnership, and sometimes, unfortunately, while the mission might align, the partnership may not align. And it's important to go into that knowing what your goals are and what it means to have an aligned partner. So I hope that helps a little bit in terms of, I'm sorry?
I can add some.
Okay, yeah, I hope that helps a little bit, and then Valerie can also add.
I just think it's really funny that you were like, not necessarily creating a new organization, since the person that's created 3 organizations and might be creating a 4th, but I'm just making fun of you because, she was my classmate in vet school, so I get to do that, but none of you do because I'll fight you. So one thing to add to that, and we'll touch on it, is the concept of saviorism, and I say it out loud, and I say it to everybody, and I say it all the time, and I see at least one head nodding. Is everybody familiar with that term? Yeah. I see. Anybody not familiar with that term? Okay. So, and we'll touch on it hopefully you'll be able to stay for the next lecture, but the concept of saviorism is a concept of when individuals come from outside of a community to solve the problems of that community without being a part of that community. And if you see who who is up here kind of talking to you, we're all individuals that are ethnic minorities, right, in the veterinary profession currently. That's not to say that that is who should be addressing all of these issues, but part of the reason why I always bring up diversity and inclusion when we have these conversations is because the data shows that the people who are most likely to go back to communities where care is needed are people that are actually from those communities. And what you'll see with a lot of the organizations that are currently being created is that it is people from those communities, right? Who is most likely to practice in rural, veterinary practice, I know words, is individuals that grew up in rural communities, right? So they're most likely to go back to those communities and practice in those or similar ones. And so when we're talking about partnerships, it's not just about looking at a community and saying, hey, I think I can solve that problem. It's about actually going in and immersing yourself in that community, because chances are individuals doing the grassroots works in those communities already know what needs to happen. They may just not have the resources or the structure or like the partnerships to really see it happen. And I see this a lot in veterinary medicine, right? We have a lot of large groups that are like, yes, we're like gonna solve all of these problems, and there's like not a single person from those communities in those. So that to say, when you're looking to start these, like, you know, you wanna do access to care, you have seen communities in which access to care initiatives are potentially needed. Like Serena said, going into those communities, figuring out who the community leaders are in those areas, and then identifying what that community actually needs should be like your number one priority. Sure, there isn't, you know, there aren't as many veterinary clinics per radius. Chances are, maybe even at the edges, there may be, you know, a community center that you can go to and say, hey, do you have, you know, a veterinarian or a technician? There may be pet stores nearby, right? So can you go into those communities and find those individuals and say, hey, is this something that this community needs, and how can I support you, right? So coming in with the mentality of we're gonna, I think, maybe it was you that were talking about, or somebody in that general vicinity, about empowering communities, right? So we're not going in to solve problems that we've identified as someone who's not a member of that community. We're going in to empower communities so that we can give individuals the tools that they need to be successful. And that's my spiel, and you'll hear it again in the next lecture, so. Cool. Other questions? Have a safe flight.
Bye. I miss you.
Any question, anything else? I was just gonna move on right on to like the next stuff. If you need water or the bathroom or any of those things, just do it. We don't care.
Well,
But come
go-
back, because
go
we
to the
love you.
bathroom.
Yeah, like go to the bathroom, not here. Ideally. Okay. Any other questions? Because now we're gonna go through and talk about all of our initiatives and some of the other initiatives that are out there. All right, so who here is involved in access to care initiatives actively? Awesome. Any initiatives that are different from like anything we've talked about today?
I guess it depends on how you define practice initiative.
How do you
So
define what?
I am involved heavily with Serena now. It depends on how you define practice initiatives. So I have identified and used within veterinary medicine online, like social media does not really talk about access to care, within like the influencing in an online sphere. And so I started doing that. I don't know if I would officially call it a grassroots initiative, but identifying that there was a need for that and doing a lack of discussion.
Yeah.
And then also involving other people in that discussion too.
Awesome. Did everybody hear that? Yeah. Cool. Perfect. Yeah, I was gonna like hand you the mic, and then I was like, oh, we'll just see it. There's not that many of us. It's not that big a classroom, so. Classroom. Ooh.
I don't know if online would be good.
Yeah, I mean, I think it does, right? It's educational, so we're going out and
So
speaking
I have
about.
online streaming of this session.
Oh,
So-
yes. Okay, so the comment was on using online platforms to be able to communicate and have conversations about access to care, and doing it as part, like with partnerships with other organizations that are doing the work. Did that cover
Yeah.
most of it? Okay, anybody else? I saw you raise your hand. Was that different, similar to things we've talked about?
Well, I'm not 100% sure because I missed the first part. I think what
That's
I'm
okay.
doing is an ATC
up with educational ways to broaden access to care through virtual care. Ish?
Yeah.
Okay.
Virtual care. I mean, it's very, I think that virtual care can be a great tool to help improve access to care.
Yeah.
I mean,
We agree, so.
yeah, 100%. And there's a lot of, the technology is outpacing what veterinarians are doing in the hospitals, and the laws around telemedicine right now. You can do teletriage without a DCPR legally, but to do other things that require a DCPR, they should have a relationship with the hospital where a tech can go get care and follow up with them there. And I want to help veterinarians do that and implement that in their practices, So that's what I'm doing. And
That sounds really cool. I mean, so you are creating opportunities for veterinarians to be able to do, virtual care through the practices that are already existing. So I think that's awesome. So the next question was going to be, has anyone started their own initiative? So I think both of these count as, pioneering something that is not currently there. So I think that's pretty cool. I guess the next question is then, is anyone planning to start something? And it's okay if you're not planning to start your own thing, because as we said before, we also are in the business of not reinventing the wheel and becoming, partners with other individuals. So it is okay to not do that, but is anyone planning to? Cool. Do you want to tell us about it, or are you worried that we're going to steal your idea? I'm just.
When you talk about things, you learn that there's already something that's similar to it.
Yeah.
So, at least in my area there, I live outside of Raleigh, so there are plenty
So do I.
veterinary hospitals, in the area. What I've noticed more so as working in that area is that we do have our senior populations there, our disabled populations that aren't able to physically get to those brick and mortar facilities there. So at least my aspect of it would be more mobile care.
Yeah.
It wouldn't be full service, at least starting out.
Yeah.
You want to build onto things there, but it would be access to wellness, preventive care education, allowing them to know where those outlets are if they do want to have spay neuters performed there, or just surgeries performed.
Mm-hmm.
And having lived in Virginia and gone down to North Carolina, at least in Virginia we had our shelters or a SPCA, that's associated with the city, that had low-cost surgery options. But in North Carolina, from what I've seen, there aren't those sort of avenues there. So trying to organize or not organize, but essentially having a list. These
Yeah.
are your resources that are available, at least that I've been able to find, to get that surgery if you need to have that surgery at low cost or affordability. These are some grant options that are available there. These are where the funding resources are, to make it easier so that we're not, as the veterinarians in the area, wasting that hour, 2 hours saying, what's out there, where can I go? To already have that information.
Do you have access to the House Call Veterinarians in North Carolina Facebook group?
Yes.
Awesome.
Yes. So again, there's those venues out there, but they don't seem to be in light.
Yeah.
They seem to be in the shadows.
Yeah. Okay. So finding ways to make people aware of the resources that are out there, but also figuring out what resources aren't, and then building some around it. I like that. Awesome. Thank you for sharing. Anybody else? So throughout this, as we talk about, what we're doing and how we went about it, think about any questions that you may have around starting, your own initiative, if that's what you wanted to do. But also, I'm all about mentorship, right? So even if you're not starting an initiative, you may at some point have a mentee that says, hey, I want to start this. So what kind of questions may they have that you would want to know the answer to so that you can guide them in the future? So we'll talk about each of our initiatives and then tell you about some of the other ones that are out there. And we're going to start with Dr. Shai.
Thank you. All right. Have the clicker.
Yes.
Thank you. Okay, so Valerie had mentioned mentorship, and so I want to talk about VetTriage Pro, which is a virtual platform that allows veterinarians to consult experienced or are dealing with a difficult case or difficult client, they can speak to a more seasoned veterinarian on VetTriage to get help in that regard. So it's basically teleconsulting at this point. And there's a paper in JAVMA published in 2022 that identified 4 different steps to mentorship in general. We all know the value of mentorship. A lot of us wouldn't be here today as veterinarians had we not the right mentors to lead us along the way. Mentorship is huge. And when you're talking about diversity, it's massive. It allows folks who normally wouldn't have thought about the profession to think about the profession. And because cultural influences are very powerful in that regard. So mentorship helps, and these are the 4 steps that this paper outlined regarding mentorship. Here are some numbers as far as where our veterinarians currently lie, especially the newer grads. Less than 50% of veterinarians receive communication training from veterinary schools. 65% believe that the vet school did not fully prepare them to face communication issues. 50% had to attend postgraduate communication training workshops. Of vet students, vet assistants, and animal keepers, 88% felt their communication skills needed improvement, and almost 60% have difficulties in effective communication. Training could improve communication with clients and the team, and 76% wish to participate in interprofessional training. Communication is a massive challenge. It's very difficult to communicate. There's both verbal and nonverbal, and we are not adequately supplying our veterinary students with enough skill set and information to be able to communicate effectively afterwards. And if you take into account that 80% of medical board disciplinary actions are because of poor medical record keeping and poor communication, we need to focus on communication. So with this new platform that we are announcing, we're launching this year, the folks who benefit from it are new graduates, veterinarians that are managing challenging or unique cases. Perhaps the client is the most challenging part of that situation. Any assistance with communication, any medical board complaint. Maybe you're seeing a pet you're not normally familiar with. Perhaps you're in surgery and now you're stuck in a pickle, so you need some advice there. How to interpret diagnostics, and it's a massive benefit for employers. One of the biggest frustrations that I hear from veterinarians who hire new graduates is, oh, that new graduate doesn't know anything. They don't know anything. What did they learn in vet school even, you know? They forgot what it was like to be a new grad. They forgot. You need experience, and it goes beyond veterinary school. And so those frustrations are real. And it's part of the reason why work-life imbalance happens. It's part of the reason why we have cultural toxicity. It's part of the reason why we have high turnover rates with veterinarians and veterinary technicians. We need mentorship for these folks. And so if you're an employer hoping to hire a new grad, that way you can go fishing 5 days a week, which is well-deserved, it may not be realistic. That new grad needs help. And so if you physically being there as the employer is not an option, then VetTriage would be a great option to help the veterinarian out. And of course, for clients and pets, it'll translate to a better quality of care. The client's confidence in the veterinarian will improve. It's of course convenient. Let's say, for example, you want to have your client wants a second opinion, maybe from another general practice, or perhaps even a specialist, and that facility is booked out for weeks or months, which is commonly the case. Well, with virtual care, you can access a veterinarian, either a general practitioner or an emergency doctor or a specialist, virtually 24/7, so it's convenient. And of course, it's affordable as well. So the platform itself, in terms of all of these parameters here, are details that are included when we partner with each other. And so how you implement it in your facility is up to you. You want to leverage it to the best of your to what is that you actually need in that practice. You can add VetTriage Pro as part of your employee perks or benefits. It can be up there with, we offer this much continuing education, we offer this much vacation time, we offer VetTriage Pro, you get 10 credits a month, let's say, to phone a friend and speak to an experienced doctor regarding whatever situation is ailing you. You can have, as an employer, a periodic or a monthly allowance and leverage it as needed, or a subscription-based model. So we basically want to tailor it to whatever it is your practice needs. The cost be passed on to the client. We are notorious in the veterinary field for giving away lots of free stuff, and we ought to not do that anymore. It costs money to keep the lights on, to keep your staff happy, to make sure things are running appropriately, and we work too damn hard to not get paid for it. You would never speak to an attorney or a CPA and not get charged for every single communication. Yet we do quick ultrasounds for free, just do a BG, but don't charge for it. This stuff is crazy, and it adds up. It's cumulative. So you can pass the cost on as a teleconsulting cost to the client and actually not lose any revenue. In fact, you can make revenue from this. We would include follow-up and rechecks, and you can either schedule an appointment with our veterinarians, or it can be spur of the moment. Just depends on what it is that you need. So we want to make sure the process is streamlined for the hospital. You have the ability to submit diagnostics ahead of time to the platform. So you have radiographs, blood work, or whatever, and you want to submit it to the VetTriage veterinarian ahead of time so they can evaluate prior to the consultation. Great, that's wonderful. You can coordinate it where the patient is being dropped off. All the diagnostics are there, and now you can talk to the veterinarian virtually with the client present or not. Just depends on what you're looking for. We'll send you a report. We're available 24/7, and it's for any animal type. So these are the outcomes that we're seeing, not just with VetTriage Pro, because obviously this is brand new, but with all of our platforms since the end of 2019. These are some of the real world effects that we're seeing on the ground in practices. When clinics partner with VetTriage, it improves retention. There's less turnover. And this is huge, not just for within the hospital, but also within the industry. We have veterinarians that are retiring too early because they don't enjoy the field anymore. We have a veterinary shortage. The new graduates graduate vet school, get their first job, hate it, and they leave. There's no reason for them to stay despite the debt. They'd rather do something else, have a better quality of life, especially when you look at the mentality of millennials and Gen Zs. They focus way more on work-life balance than they do working 60 hours a week as a veterinarian and being on call all the time. So I've had clinics that will actually leverage the fact that they've partnered with us to hire new veterinarians. They'll say, look, we know you're on call with our practice. However, with VetTriage, who handles our after-hours on-call services, 80-90% of those calls are gone. You won't even know about them. They only will call you for true emergencies after being triaged by a veterinarian on live video. So it creates easier hiring, and it's a better return on your investment. Headhunting is expensive, turnover is expensive. Hiring folks, onboarding them, firing them, or having them quit, all that's expensive. Improved hospital culture. So by access to a platform that's 24/7, either you as a veterinarian talking to another veterinarian, or you as a pet owner wanting to speak to a veterinarian about is this an emergency or not, this improves individual patient care. It improves client confidence in what's going on with the communication between them and the veterinarian, and it allows the employer, the owner of the facility, to have less worry and more rest because your new hire can talk to a veterinarian who's seasoned in real time, 24/7. New veterinarian graduates, the benefit to them is they can customize the caseload to the vet experience, to their own individual experience as a veterinarian, so it's more individual case focused. So, for example, let's say you are a general practice and you allow urgent care or walk-ins to come in. There may be a certain caliber that you just can't handle as a new grad. You're taking a long time to handle a consult, or perhaps you have 2 or 3 really sick animals, you can't handle an additional one. And so you can leverage your own time by consulting with a professional, with a veterinarian who's more experienced than you, which is great. Or you can tell that client, I can't take care of you. If ER is too far away or too expensive, or you're not sure you have to go to VetTriage, meet with a veterinarian virtually, and they'll triage and give you advice. And then individual facility solutions. We tailor everything to your own hospital, depending on how you operate, whether you have interns, residents, new hires, and it's better medicine and improved revenue. We went over this initially in our talk. The only thing I'll mention here, because this goes over the different types of telehealth, the B2C, B2B, and B2B2C. So for VetTriage, because our primary goal is partnering with facilities, we are more of a B2B, but of course that does translate to the consumer eventually. So your practice would partner with VetTriage, send over a case, and then VetTriage would talk to the consumer. And so we're in line with this methodology there. But the rest of this we went over in the previous, and I'm happy to answer any questions. We went over this slide prior. This is actually an old one where our numbers are way larger than this now for VetTriage. But I'll go over it. We're approaching 150,000 cases now. We've been accessed by over 20 countries, 40 plus animal types. We've got 65 70 doctors currently on staff, and that's growing. Handful of support staff that manages customer service. We're operational 24/7. We have almost 1,000 partners now globally. Spanish-speaking platform in 2022, equine platform in 2023, now VetTriage Pro, and we published our first publication December of 2023 in Frontiers Veterinary Science Journal. And there's 4 more papers to come. This is, we had mentioned this earlier regarding urgent care, and a lot of you are familiar with these types of charts where we have the client kind of assess how urgent or not it is, hoping that they can basically do like a self-triage. And this stuff really, in my opinion, doesn't work. You want a veterinarian triage it. You don't want the client doing it. So for example, you can see here there's a level 3, let's say. It's urgent, pet stable, and not eating is included. Well, yeah, if you're like a 3-year-old dog and you haven't eaten for like 2 days, yeah, maybe it's not an emergency, but it's concerning, of course. But an obese cat that hasn't eaten for 24 hours now is prone to hepatic lipidosis, but the owner doesn't know that. And so you have pet owners saying, oh, okay, well, we're only level 3, we're not at level 1, so we can probably sit tight and wait for our vet to open on Monday morning, and now it's Friday night. Meanwhile, that cat's becoming icteric and over the weekend. So I'm not a fan of these things. I understand the point, but for me, you want to have an actual triage process that's reliable, and that's with a veterinarian on live video. That's the best way to do it. If anybody wants to take a picture of this, I won't go through it in too much detail, but this is the process that we use for partnering with VetTriage. We'll create for you a landing page, flyers, individual protocols, and this is both for VetTriage Pro, but also for your clients for during daytime overflow or after hours. We create a flyer for you. This is the Cornell one, so it has a little paragraph as like why we exist. There's the Cornell landing page, which the client can click on if this is digital, and then there's a QR code they can also use to be directed to the Cornell landing page and access VetTriage. And so this is just a reminder that we have both our standard platform, which is non-equine, and then our equine plus Espanol plus VetTriage Pro. How much time do I have? I don't want to take too much. Are we okay? Couple minutes. Okay. So these next few slides are just to kind of show you the process when a clinic partners with us, how things look. So this is a facility in Hawaii. Hawaii, of course, has problems with access to care. It's a freaking island, and so if they're not doing on call, there's nobody there. You have to fly to the next island or wait for your vet to open again. So they have us in the bottom of their website under the emergency section with a clickable link. Here's another facility that does all as mixed animal. The client would click on the link, get to this page, which has your hospital logo on it, the paragraph, how to sign up. The client will put email, name, phone, what language, is this for a horse, yes or no, and then go from there. Here's another facility that does mixed animal as well, same thing. The client will create the account, go ahead and click buy your session here. This is for equine, that's why it's $75. Non-equine is $50 for as much time as they want. They have to agree and understand VCPR and the current laws. So they click on agree, they pay, then they click step 3, which lights up, and then they're on with the veterinarian in less than 2 minutes. And that's the entire process for them. If you notice, by the way, in the account, this part of it, no signalman, no chief complaint, no nothing. It's triage. And I want people who are freaking out about their pet to get on with the veterinarian as quickly as possible. If I have them writing down breed, species, weight, age, whatever, they're gonna quit out, they're gonna go. And I need them to streamline that process so that they can talk to a veterinarian right away. I don't know whether or not we have just a limping puppy or a distant cat on the other end of that device. I have no idea. I need them on as fast as possible. You also notice we don't have an app. This is all web-based, and that's on purpose. I don't want a client who's freaking out, having to go to an app store, finding the app, downloading it, then creating the account. That's a mess. I want them to go right to the website, fill it in, pay, and they're on with the doctor. This is my information. If anybody has further questions, wants to talk to me further about this initiative, feel free to take a picture of that, all my social media, and then the link, and yeah, thank you so much.
I didn't know you had a TikTok.
Oh yeah.
Wow.
All the things, YouTube,
Yeah.
TikTok.
Yeah.
I'm out there in the socials.
Amazing.
I know.
Okay.
Kids say.
still get through this. But yes, so basically identifying the components of the ecosystem would be the veterinary service providers, so how the veterinary service providers can create a spectrum of care by collaborating with one another and complementing one another's services. So we have primary care overlapping with urgent emergency care, overlapping with specialty care, and kind of creating a full circle there. And creating an equilibrium between veterinary service providers and the community, which would be the pets and the people. In order to create that equilibrium, we need to identify aligned partners in the ecosystem. So that would be, community organizations over here, B2B services over here, and then teaching and learning organizations over here. So some partnerships that we've been building to enhance the ecosystem and create access to care and therefore access to the profession would be Chapter 8. So that's a 501c3 nonprofit that we started back in 2020. That was founded to enhance access to care and education at the intersection of marginalized pet parent and veterinary professional communities. We do so by way of inclusive professional education, community education, and financial accessibility for marginalized pet parent communities in need of immediate care. So within the inclusive professional education realm, we have externship and internship opportunities for veterinary professionals that belong to historically marginalized communities. And we actually had our first extern this year, and she's here in the room. It's Lena. Yay. Yes, and if any of you have any questions about the externship opportunity, then I'm sure Lena would be able to give you a candid reflection. But essentially, the externship opportunity is to connect underrepresented individuals with opportunities to learn more about access to care, and doing so in an accessible way where they receive this opportunity, which is funded. A lot of individuals from marginalized communities that are seeking to gain educational opportunities and access to care, unfortunately are unable to do so because of the fact that these are expected to be like volunteer opportunities, or maybe they have to travel and they don't have a way to get there. So our externship opportunity is focused on making the education itself accessible, as well as the content of the education about accessible care. And so Lena was able to actually rotate with Inclusivet, which is another organization that I started that's Inclusive Veterinary Relief Services. So we partner specifically with low-cost and or underrepresented, undermanaged clinics to be able to highlight what they're doing and make relief care a more inclusive and accessible place. And this ultimately allows practices to expand their access to care because it relieves them of the burden of having to be there all the time. So Dr. Lena, I should say, yeah, you deserve it. Dr. Lena just graduated from the University of Illinois and rotated with Inclusivet to go to a few different primary care providers that were all low-cost clinics and or underrepresented, undermanaged clinics to learn more about accessible care on the spectrum of care, how different communities need access to care, what that looks like, and how that's provided within those communities. And at the end of that externship, Dr. Lena got the opportunity to build out their own community outreach project, which was a free vaccine clinic in partnership with one of the primary care providers, Jazzy Paw, which is an affordable care clinic in Hampton, Georgia. So this is kind of how we have relationships between organizations in the Atlanta ecosystem. The third organization that I and a couple of other really wonderful people are starting up right now is Vetulence Community Care, and that model is a co-location model. So earlier we were talking about how opportunities, negotiating it out, all of that, and providing, of course, what would be expected from a part-time employee position, so workers' comp and such. But the responsibility of the veterinarian or even veterinary assistants, so we have actually hired on veterinary assistants as well, would be to go in and provide medicine in an inclusive and accessible way, specifically at these clinics that we have partnered with. So that's kind of where we're at with Inclusive Ed. It's definitely something that I think would be really cool to expand upon. So if anybody's interested, then please let me know. I'd be happy to talk more with y'all on that.
We could grow.
Yeah, I'm hoping to.
Yeah, market it and grow that.
Yeah.
It's a great,
Yeah.
I love that business idea.
Yeah?
Yeah.
Let's talk more. Yeah. Does anybody else have any questions about these many things that I'm involved with? Huh?
We only have 10 minutes left, so
Oh.
you might want to sit in.
Okay. Don't ask any questions.
Yeah.
Yeah. Okay, I'm gonna try and see if this animation situation, oh, it does. Okay. All right. So, this is the case study in the Atlanta ecosystem, to kind of give you a more visual perspective on it. I don't know if you guys can see this person up here or not, but this is Dr. Lena over here during her externship opportunity, and this is an example of just the community having access to inclusive and equitable care and education. So that was a free vaccine clinic that we did for the community. I'm gonna talk faster so that we can get this done faster. And then on the veterinary service provider side of things, we have the primary care clinics. So these are examples of the clinics that Inclusive Ed works with right now. Would be Lifeline Animal Project, Jazzy Paw. They're going to be expanding access to affordable care on a preventative and wellness care basis. And then we have, VetBulance Community Care, which would essentially partner with the affordable access to veterinary care clinics to provide urgent care services during their closed hours, ultimately offering a more financially and environmentally sustainable opportunity for the community, and with that long-term goal of offering early entrepreneurship and leadership opportunities to underrepresented individuals in veterinary medicine to combat that high debt-to-income ratio. So down here we have the community organizations that are aligned partners to create this equilibrium that is essential to create accessible care and an accessible profession. So Chapter 8 from the community basis and from the community organization basis has been offering free vaccine clinics, bilingual preventative and illness care education, which is something I touched on previously. I think it was a question from somebody who had to leave earlier, and bilingual youth education engagement programs, along with financial support for marginalized communities in need of immediate pet care. Another example of a community organization in the Atlanta area would be Pralines Backyard Foundation. This organization is working with survivors of domestic abuse to ensure that their pets are going to be taken care of during sheltering periods and pause between homes, works with individuals and their pets who are experiencing a housing crisis. So it's very important that we're all able to work together in order to represent the community in a way that is beneficial to them, but also for these organizations to be working directly with these veterinary service providers, so that way they have a better idea of what the community needs are. And then from the B2B perspective, we kind of touched on what Inclusive Ed does, and we also have other B2B organizations that are going to be like software providers, medical supply vendors that are supporting this ecosystem as well by providing financial support, potentially favorable pricing to, for example, nonprofit providers, making it more feasible to offer the type of care that they are offering, and helping to create efficiencies for these veterinary practices. And then from a teaching and learning basis, we also touched on this. Chapter 8 would be able to offer externship and internship opportunities in partnership with Vetulence and Inclusive Vet to provide inclusive education. And then veterinary schools are going to be providing credentialing and training for veterinary medical professionals. And this is something that we would like to partner with more so with veterinary schools on as well, in order to train their students on accessible care. Just because there is a lack of education in this area, maybe not every school has the capacity to do so, or the expertise to train in that particular area. So it's important that we create access to that, and that would be the goal with the teaching and learning organizations. I'm going to go ahead and hand it over to Valerie. I hope I didn't leave you with 0 time.
Oh, we have 5 minutes. Right. So I think many of you know who I am. Does anybody need a reminder? No? Good. So I started a nonprofit, and idea of it came up in 2016, officially got 501c3 status in 2020. Our core values are really building a community leadership, service, inclusion, and we use those core values as our why, right? And our how is our mission. So we use mentorship, professional development, and resources to create the vision that we want to see in the world, right? So the vision of our organization is building a robust, inclusive, and thriving community. And we see that, our core values as the root of everything we do. And as I mentioned in some of the previous ones, I like to live by Simon Sinek's idea of start with why, right? So our why is that community. Our why is the inclusion. It is the leadership. And our tools are being able to provide individuals from communities that may be historically underrepresented or historically marginalized in VetMed with those resources, the mentorship, and the professional development tools that they need to be successful in the profession. So when somebody says, yes, I may want to join veterinary medicine, whether that is as a veterinarian, a technician, an assistant, a practice manager, we want to be that pipeline that helps them find the resources that they need throughout their journey, whether that is a mentor, whether that is access to an externship, somebody to answer questions, somebody to review an essay, whatever that may be for them, right? So the idea is empowering individuals to then be able to build a better profession from within. I find that a lot of times we go out and we speak about veterinary medicine, you have the individuals that are talking about it are usually trying to get people to come into the profession. So what tools are we providing long-term for individuals to be successful? If any of you, look at some of the studies and some of the data, you may know in 2020, the AVMA Econ Summit did a study where they broke down the debt of veterinarians that were graduating by race and ethnicity. And what they found in that study is that in 2020, your Black African American veterinarians graduated on average with $100,000 more than their white counterparts. And for Latinx veterinarians, that was about $50,000, right? So what tools are we putting in place so that individuals coming into this profession who are part of communities that are already, right, historically undersourced and underserved, how are we making it for them to at least have equity once they get into the profession? So it is for the people of VetMed, right, on the nonprofit side, looking at supporting the current and future of our profession. But then I also do my own, did I skip it? I guess not, I don't know. Okay, on the for-profit side, I have Valkyrie Consulting LLC, and that's where I do, services, support for different teams, really for consulting and things like that. And Valkyrie Consulting is looking at increasing accessibility, whether that is to care, whether that is to food, and whether that is to teams in veterinary medicine, so through relief work, through vaccine clinics, through consulting in poultry medicine, through working, in GP and access to care, and through getting involved with organizations like these here, and being able to say, hey, these are organizations that exist, and this is how you can be involved with them. The general principles of wanting to or thinking about starting your own, kind of organization is thinking about the why, right? And the purpose, and then when you start thinking about where are these funds going to come from, and what kind of people may need your services, and who are you going to work with, and where do then you can start putting all of those things together. What portion of this is for profit and what portion of this is non-profit, right? So if you have, say, a clinical practice and your goal is to do access to care, does it make more sense to have a branch of your for-profit organization as a nonprofit, or does it make more sense to partner with nonprofits that are already existing, right? Like, where the vaccines gonna come from, right? How does that impact whether you use like your current employees for your for-profit side and have them help out for whatever nonprofit, initiatives you may have. So the goal, as I mentioned earlier, for any of these initiatives, in our humble opinion, should be to empower individuals from underrepresented and marginalized communities, right? Consideration should be, are you a member of that community, right? And that's not a requirement, but you should always consider it. And especially if you're not a member of that community, are you working closely with leaders in that community to understand the challenges that community faces and the ways to avoid it, and the ways to address them, the ways to avoid them. So you want to build and support communities. That is what we're all here to do. And you can do that by thinking about whether there is already an existing organization doing that work and deciding whether it is better to amplify those existing initiatives and or create your own. And those are not mutually exclusive, right? You can create an organization or an initiative that supports existing initiatives and supports the infrastructures of that, right? So my initiative is very different from the other initiatives here, but they all complement one another. So how are they working together? How can you work together with these organizations if they already have similar goals? And again, we've already sort of mentioned saviorism, but avoiding it, just because you have the resources doesn't necessarily mean that you should be the person doing the work, right? Especially if you're not a member of those communities. It's just considerations to be had. And just because you're a member of one community that is historically marginalized doesn't mean you can't be you can't do saviorism for other communities, right? So I'm a member of the BIPOC community, but I'm not a member of the LGBTQIA community. So my role in the LGBTQIA plus community is to be an ally and to support individuals from that community, right? As an individual that is, BIPOC and has done a lot of the work to learn about the challenges and try to address them, then on that side, I'm more of an active leader. So you can be an ally to other communities, regardless of whether you're a member of, a different community or not. When it comes to access to care, there are a lot of initiatives out there. So there's the Access to Care Hub, there's the Access to Veterinary Coalition, there's Pets for Life, the Rural Area Veterinary Services, the Street Dog Coalition, the Vet Care Accessibility Project. There is a couple of the grassroots ones that we didn't mention, where VESPICON, which is a way where GP veterinarians can actually access specialists. So we were talking about the shortage of specialists out there, right? So if you have a case and you need to talk to a cardiologist, you may be able to get a consult through VESPICON, right? So it's slightly different, right? It's not always what we're always thinking when we think about access to care, right? But the fact that we have a shortage of specialists and that there is an organization out there specifically looking at addressing that is still looking at access to care, right? We're still broadening care for our patients. There's also Vespacito, and they're working on resources for individuals that speak Spanish primarily who may not be fluent in English. So in terms of resources, some of these are going to be listed in both places, but there's Aligned Care, the AVMA Foundation REACH program. We talked about some of these, VESPICON, VetVilance, VetTriage. So there are a lot of organizations out there, and chances are, if you are like, I want to do this and I want to help a community, there's probably one of us already trying to do that in some form or another. And the question is, does it make more sense to work together and be supportive that way? Does it make more sense to create partnerships within different organizations? What makes sense for what it is that you want to address? So I just wanted to give you guys, we wanted to give you some resources to look at. So if you need me to go back to either of this, let me know.
work in. So if there's a concern for that, I would look into, in your area specifically, if Pets for Life does offer transport, because that has been something that I've noticed that is immensely helpful to community members in the greater Atlanta area.
Yeah, and I would say for some of them are, more national, some of them are more local. If you are like, okay, there's a need for something similar in my community, I think most of us that have gone out of our way to create these organizations want to see them happen in other places, right? So at least me, and I think us here, are not necessarily thinking that you're all competing with us if you want to create something that is local, within your own communities. And we're happy to talk about why we created what we created and how we did it to help you all address the needs of your communities, because every community is different. Questions, comments, concerns? Awesome. Thank you all for joining us for these past 3 hours.
Yes, I have a radio show to do. In 5
very
minutes.
cool.
Yeah, thank you.
Okay. Well, maybe
You
I'll
want-
I
Yeah.
can walk with you.
Okay. I was gonna find somewhere to sit, and then it's a Zoom call. Yeah. Oh, thank you. I appreciate your support with it.
Yeah.
Most folks in the audience are always like, "Here are reasons why you shouldn't do this or why," and I'm like, "Shut up."
Because people don't understand, and
Yeah.
it's confusing.
Yes.
In their defense, I just sat
Sure.
I sat on an AVMA meeting
Oh.
about medicine
Yep.
legislation just now. This is-
Yeah.
I mean, yeah, it's confusing, and there's conflicting
Yeah.
messages.
And yes. And I kind of wish organizations like mine were brought into those discussions with AVMA. Nobody asks us for like.
It's like, I don't know how I got in there, but I need a friend
Yeah.
who is like the president of, technical services, and I chatted him up and I was helping him out, and he was like, oh, here's something I got to find you about telemedicine. I don't know what this is really about, but here, come with me, and here I am sitting with the AVU president. Anyway.
Wow.
So,
Yeah, I'd love to be part of that.
Yeah,
They
they're
don't-
gatekeeping this.
Yeah.
And there's definitely some, they're fighting up against people with lots of money with technologies and people that are trying to be progressive. And part of it is, they want to uphold a veterinary client-patient relationship.
Sure.
But and saying that they promote telemedicine at the same time, they're very conflicting what they're saying
Yes.
and what they're doing.
Yes.
So
Yes.
anyway, I worked with Ask Vet and Air Vet.
Oh yeah. Yep.
Yeah,
I know that.
in the pandemic. And I guess one of my questions for you as I do this and I think about scaling my project is, how do you pay vets enough to keep them?
Volume. They get paid per case that they see,
Okay.
and we have enough data now to know when our peak hours are. So
Yeah.
for those who really want to make good money, focus your time on peak hours. If you just want to do this for fun and you don't really care, then focus on non-peak hours. And
Yeah.
it's all volume based. There's of course
Okay.
many ways you can do it, but that's how I do it.
Okay, so vets get paid
Per case they see.
Okay, and can I ask, what are the numbers with that? Or
Yeah.
is it rude
So
to ask that?
no. The
Okay.
non-equine vets get paid $20 per case.
Mhm.
The equine get $35 per case.
Okay.
And the average time a doctor spends with the case is roughly 10 to 12 minutes, somewhere around there. So I
Okay.
want them seeing 4 to 6 an hour.
Yeah.
It of course.
And they're all live videos, they're not asynchronous chatting.
Right. 99% are live video. We have people who live so remotely they don't have internet or a video device, and so they have to be a phone call. In which case we try to can we email? Can we text pictures? How can we get images? But the vast majority are going to be video live on our platform.
Okay.
Yeah.
Okay, well that's helpful.
Are you looking for to join, or what do you?
I'm thinking about, so I'm my project, and let me know if you've got to go.
Yeah, I have to log in
Okay,
to this.
well, just I'll reach out to
Like,
you
okay,
separately.
okay, okay,
Yeah.
okay, okay.
I'll send you a message and then
Sure.
you'll have my
Thank you so much.
Yeah, of
Thank you.
course.
Sorry, I
Thank
crammed
you,
for
thank-
time.
No worries. Thanks for taking a minute to chat with me.
My
I'll be in
pleasure.
touch.
Okay.